Hi everyone, welcome to another episode of Behind the Mask. Behind the Mask is our monthly video series that highlights perspectives from people in healthcare teams, individuals, and with a particular focus on showcasing often overlooked healthcare professionals and connecting their work to patient outcomes. Each episode that we do features authentic conversations that shed the light on the roles, innovations, and relationships that drive surgical and clinical excellence. The work that happens behind the scenes, but is critical to delivering better outcomes for patients. So today's episode is episode 5, and we have with us our guest, Trevor Duffy. The purpose of this episode is to focus on the creation of a centre of excellence and the innovation in decontamination at Matter. This episode is going to explore how Trevor and his team have built the Matter's decontamination service into a recognised centre of excellence, not just in Ireland itself, but across the world, it's fair to say. And that attracts visitors from both UK and overseas, trains professionals internationally, and drives innovation through technology partners. The Matter has embraced transformation over the past 5 years, developing solutions that, like the award-winning Bicar manual cleaning system that's now being adopted in the UK, and pioneering an approach to equipment testing that directly impacts the patient outcomes. So what we're going to explore today with Trevor and I, before I hand over to Trevor, is how that sort of practical realities of creating innovation happen within a hospital setting, and the challenges working with equipment manufacturers, some of the complexities to bringing in new technologies, and then working on how they're developed throughout their pilot lifetime. So, Trevor, first and foremost, thank you for joining us on this week's, this episode, I should say. I thought it'd be really helpful if you could introduce yourself to the viewers of this.
I'm Trevor Duffy. I have a dual position here at the Mater Hospital, so I'm CSD manager and decontamination lead. The Mater Hospital is one of Ireland's largest level 4 acute teaching hospitals. We're positioned in Northside city centre Dublin. We have 17 national centre specialities here on site, so you can imagine we're extremely busy. Currently have 16 operating theatres, with 2 more being commissioned at the end of Q1. And we're just shy of 1,000 beds on site. So that's a little bit about us, and I'm sure you can understand how busy we are.
But yeah, and it sets the scene quite nicely for probably why you set yourselves up as a centre of excellence, because there's lots of complexities, there's lots of specialties involved, and as you just said, the number of beds that are there. I think the best place for us to start, Trevor, is just telling us more about how you achieve a centre of excellence. Like what sort of processes do you have to go through to sort of show this in practice? Like, what makes the Matter different from other hospitals?
Yeah, so I suppose how it came about first, I suppose it was timing, and I can't take any credit for that. I suppose in 2018, 2019, the hospital wanted to develop a robotic program. So all of the key stakeholders were involved in seeing what it would take each department to help the hospital achieve that. So part of that was CSSD looked at its low temperature sterilization program, and it was identified that we needed to make significant upgrades to that. Our system then was 10 years old and reached end of life. So fast forwarding, we ran a tender, we purchased a new low temperature sterilizer. And then the timing of that was we just purchased a new sterilizer that was being released to Europe. So we were the first ones to implement that sterilizer with all of the additional pieces that came with that ecosystem, electronic traceability, all of that kind of stuff. So fast forward a couple of months later, the company got in touch to say, look, can we come? Can we have a chat? Head of education came over and basically said that the sterilizer that we were using was already being used in the US for quite some time. And in the 5 or 6 months that we had used the system, we were already the highest users of their traceability system. Yeah. So fast forward from that, we done a tour. I showed them exactly what we did, and they were really taken aback by our processes, how my staff deal with these medical devices, and the new technology that we had implemented. And I suppose from there it went, and we were asked to be a centre of excellence. So it's completely non-commercial, and it involves all of the decontamination steps that we do here in the Mater.
Yeah. That's the fair point from this as well, is that it's achieved, like you said, it's not commercially achieved. It's achieved through the processes that you've undergone yourselves or helped develop. And then the question I have as well is that the kind of the factoring in the overseas part. When people do come in from overseas, like what's the particular focuses they're quite taken aback by? Are they sort of suggesting that, you know, is this something that you would expect would be standard and it's not quite standard overseas, or is this that actually the technology can be far more advanced or far more utilized than it is?
Yeah, so I suppose if you look at the matter, the whole decontamination process, like I'm certainly not saying we're the best at this or we're the best at that, but we have very good standards and protocols here. I suppose when the program first started, we were I'd call it shared learning experiences
Mm.
from people from the UK and Ireland. We had people from Europe, Middle East, the UAE. And I suppose what it looks like from somebody on the outside, it's like-minded people coming together, sharing experiences, and coming to one location where other people have recognized the best practices that we have in place. And I
Yeah.
suppose it's very much about me learning from them as much as they want to learn from us.
Yeah. And by the sounds of it, that's you forming partnerships, not just with, other, professionals within this space, but also with the suppliers as well. And from what you've mentioned, so that it kind of brings us on to the discussion about innovation within this space as well, and how that's formed through partnerships and through technology. Um, there's this the sort of the national traceability work that you're involved in. There's the innovation from the suppliers that you're working with as well. From what you've had more recently, the Bicar Med one, there's a lot of visitors that you're getting for that type of solution. Well, like what problem were you trying to solve necessarily with that? Like what gaps were, and this probably tails into your how you work within Matter, which is identifying what the problem is, if there's a solution to help them with it, and then it's that collaboration piece of bringing them in to sort of work with them. So what's the sort of the latest technology aside from what we've already mentioned? So you mentioned low temperature sterilizations, but I know from visits to yourself that the bicarbonate system is getting a lot of attention as well. What were you trying to solve with them?
Yeah, so I suppose when I originally saw the Bicar Med system, I originally envisaged this as a solution to a health and safety problem that we had.
Hmm.
So I suppose during the pandemic, it was very well documented of the risks associated with manual cleaning. Manual cleaning is in our standards, so it's something that we must do. But obviously, manual cleaning is an aerosol related procedure that poses risks to the decontamination staff.
Yeah.
So my goal was when I saw this was hopefully to introduce this as a mechanism to reduce the risk. We have a Health and Safety Act here in Ireland, so it's up to managers and hospitals to create a safe working place for our staff. So that's originally why I wanted it. Obviously, um, after trialing the system for a period of time, there was many other benefits that came with it that I wasn't expecting. And I suppose it was those added benefits that helped me build a justification to purchase it.
Yeah. And this is quite typical, like you said. So when innovation is coming on board, it's not just suppliers suggesting this is why, this is what we're trying to de-risk. It is that compliance with obviously, like we said, working in partnership on them. And then I guess, like, talk me through more of the process here on how it goes from being an idea, all that sounds something that can help us, to then translating that into something, because we know from Bike Med that they're winning awards and it's being adopted furthermore in the UK. And it's not just with yourselves, but obviously there's a starting point for both parties. How does it go from that idea to then transcribing into it's solved X, 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 and Y, Y, Y?
Yeah, so look, I suppose it was the other benefits that came with the system that allowed me to build the justification to purchase it. Like I said, the selling points for me was health and safety and trying to create a safe place of work. My CEO, my previous CEOs hate me saying this, but the financial side doesn't come into it for me. I just need to provide a safe product to our patients. But obviously, when we did implement this and we tried it for a couple of months, um, I was able to show all of the kind of the extra sustainability benefits that came with this system. And obviously, sustainability plays a big part into how we run the hospital on a daily basis. So after running it for a year, we were able to reduce our PPE by 13%, and that was purely reducing plastic waste. Then, say from the consumable point of view, we're talking about chemistry, more plastic brushes that you would associate with the manual cleaning process. We reduced that by 40%.
Yeah.
So there was huge cost savings there to the hospital, but also all of that waste that was saved, we were able to reduce our clinical waste. Here in Ireland, we don't incinerate in Ireland, so we ship our clinical waste off to mainland Europe. So all of that comes at a huge cost.
Yeah.
Health Innovation Ireland were in, they heard about this product, and so they asked us to submit a piece about it. We put in a pitch about obviously the health and safety point of view, and then all of the additional sustainability factors that we were able to showcase. And then, yeah, we were lucky enough that the product was successful and chosen as the winner.
Yeah, brilliant. And I think the where you mentioned Health Innovation Ireland, is this quite a common ecosystem for developing things? So, you pitch the idea, it has to reach certain metrics. So, cost savings are probably one of the hardest things to always necessarily prove, because there's that level of, there is a cost up front, there is a funding point up front before we can start saying the results, essentially. But is that sort of a typical ecosystem? So you go to Health Innovations Ireland, they have interest in looking at products, and then typically it becomes more of a, let's monitor the outcomes, let's do SWOT analysis, essentially, all those sort of things. Is that quite typical?
Yeah, like obviously this is like I suppose the Bicarb system that we looked at nearly 2 years ago. That was the first new innovative product to reach decontamination. We've had new variances of medical washers, autoclaves, steam sterilizers, low temperature sterilizers, but this was unique. It was completely new, and I suppose it caught a lot of people by surprise, including myself. And I suppose that's why Health Innovation Ireland was really interested. And I suppose when it was pitched to Health Innovation Ireland, it's not. I don't want to kind of limit the product, because the product could go into mortuary departments, ENT practices, primary care. It's not just specific for CSSD. So the range that this product can go into is huge, not just in healthcare.
Yeah, nice. And I guess it brings me on to my question, because if you look at what you said earlier, which is the cost thing isn't something that comes to the first for you, and the argument will always be, well, that wherever there is a cost, there's a reason to put business cases and stuff together, isn't there? So was there anything that you can tie into where you see, if we're going to present this to other people, as to say, look, this is something that you can consider, securing government funding or securing funds or initiatives as part of a trust or as part of a large organization like the HSE? Like, what sort of routes do you have to evaluate at that point, or is that something that really it depends solely on the site and the person? Like, I guess what I'm trying to get into is more, what would you put in the pitch that helps elevate your opportunity to that point?
Yeah, I suppose thankfully here in the Matter, I work in a unique place. Like the hospital promotes an environment of teaching, learning, research, and innovation. And so that really helps us as managers, that we're able to look at this new technology and innovative products as potentially products that we could implement here in the Matter. I suppose from a funding point of view, obviously as a public hospital, we are funded by our Department of Health, which is the HSE. So there is the NERP, so that's the National Equipment Replacement Program. So normal decontamination equipment that you would expect to see in every CSD department, instrument washers, autoclaves, endoscopy washers, AORs, heat sealers, all that kind of stuff would come under that. But obviously the Bicarb system was unique as it was just newly launched. So the funding for that had to come from the hospital itself. So it was me showcasing all of the cost savings that we were able to implement, obviously reduce the risk to staff, given that we were still towards the tail end of a pandemic. It was all those key factors that was able to help us to introduce it. But obviously, I needed a lot of support, and obviously the support of finance as well. So it's
Yeah.
very much on the person, but hopefully the fact that we've done all the hard work, this may be rolled out nationally, and other managers in Ireland could benefit from it.
I guess the question I have for you then is this has obviously been a typical approach, like you said, you've had the successes through the low temp sterilizations, through the new autoclaves that you had in place. Like, and you've clearly identified how you can demonstrate the value and more so the positive outcomes that come from this as well, because that's the important piece, and that's why it's reached us national recognition. If you were going to approach, or say someone within a similar position in their organization was to approach and say, what can we learn? What can we do to sort of build similar capabilities? What would you say would be the starting point?
I suppose something that we're all guilty of is not to be afraid of change. We're all guilty of that from time to time. We don't like change. Also, as well with the Bicar Med system and other products that I've introduced, trialing these pieces of equipment, writing business cases, all of this kind of stuff, it can be difficult and challenging. So I suppose not to be afraid of that, because obviously we're all here for the same value and the same goals, and that's to provide hopefully a product to our patients that will help them in their illness and try to recover far quicker.
Yeah, perfect. And it kind of leads me on to the next part, Trevor, which is that outcome piece as well. So you've demonstrated the value, demonstrated the cost saving, but the biggest center of any discussions really in decontamination is that patient safety and the outcomes that you can provide on that. So have you got any examples of the decontamination steps that are involved in some of these innovations that directly impact patient outcomes too?
Yeah, so obviously, look, we've mentioned the Bicar Med system. I suppose there's loads of other systems that we've introduced to try to help improve the product for our patients. One of those would be functionality testing. So obviously, every CSD department does visual checks and so on and so forth. But for rigid light scopes and for light leads, there was no functionality test for those. You put the lens up to your eye, you rub your fingers at the bottom, and if you see your fingers, then it's working. But that's not really scientific. It doesn't test the functionality of the scope.
Yeah.
So about 8 years ago, we purchased a piece of equipment that obviously is connected to the cloud, and all of the leading scope manufacturers feed into that. So if we test an Olympus scope today, the 5 key parameters of that scope is tested in the tester, and the tester connects to the cloud, and it goes into the Olympus IFUs. And if the scope is within the limits of the IFU, it's deemed a pass. We pack it, we send it up, and our consultants are operating with a scope that passes the decontamination process and the functionality testing. But then if that scope fails for whatever reason, the scope is taken out and it's sent for repair. I suppose what has changed from the past, the consultants wouldn't have known that scope was damaged, wouldn't know it was broken. The nurse would be handing this to the consultant. They would have realized it wasn't working. So then what you do is you open another set, or unfortunately, in some cases, if a set wasn't available, then the case is cancelled. And look, I suppose for patients, coming to hospital is a very stressful and worrying time. So we don't want to have to cancel patients because medical devices aren't available. So I suppose that product has really helped us improve the outcome for our patients.
Yeah. So nail on the head there. Obviously, cancellations has more than an adverse effect than cost to hospitals. You know, it's that human factor that it needs to cover over as well. And I guess when you bring in new technology and equipment challenges, how do you keep the patient outcomes central? You know, it's part of this. You know, how, because I've been sat in positions before where the question always comes to costs, and you're almost like, well, actually, the outcomes is what we're focused on. So how do you maintain that being central to all discussions?
Yeah, so like I said, I never have to worry about cost. So whenever I'm at committees or chairing committees or so on and so forth, I always try to put myself in the patient's position or in the position of a loved one that's here with a patient. Like I said, it's very stressful, it's very worrying. And the last thing you want is a patient just before a procedure, they're told it's cancelled, or I think at the moment everyone turns to Dr. Google before they come to a hospital and they find the worst possible cases. So definitely here in the matter we very much put our focuses to patients first and delivering a product that we deem is acceptable to them. And then what that does for us, it means we're treating patients far quicker. We're discharging patients quicker, we're getting patients in, and it's reducing our waiting lists.
Yeah, brilliant, Trevor. And I think this is a discussion that we've had in the past, myself and you together, and even so at some events that we've kind of been to together as well, is that there is still a manufacturer challenge. We've got some manufacturers who don't even know the sterile processing departments exist at some stages. The disconnect between device design and practical decontamination does still exist. So paint a picture. What happens when new equipment arrives that hasn't necessarily been designed with decontamination in mind? In some situations, you might be an afterthought.
Yeah, so look, I suppose here in the matter we have a decontamination committee. So any new medical device that wants to be introduced by the hospital needs to be approved by that committee. Before that committee was implemented, and I'm sure many of your listeners will agree with me, medical devices have come in that is not compatible with their decontamination processes. And all of a sudden that becomes a very expensive single-use item, or indeed it's just never used at all. So it's about getting the correct people on those committees, the likes of clinical engineering, IPC, the clinicians themselves, and of course your decontamination lead, because they're the ones who understand these processes. So yeah.
And I think not even like today, while that committee exists, do you have manufacturers and suppliers coming to present to that committee, or is this more, we've got a product, we've got a really good innovative idea that we want to bring into our equipment log? Is this acceptable? And then does it kind of get decided, or do you have people directly coming to you for advice on things now?
Yeah, it's a bit of both. Like obviously here, like in the matter, like there is certain companies and suppliers that we would have relationships and contracts with. So I suppose it's really about engagement. A lot of the suppliers that supply the matter, I've invited them in here to the department. I've walked them through our processes, because, like, unfortunately, when these companies are manufacturing medical devices, yes, they type test and they do all of the tests that are required, but it's not in a real life scenario. Yeah, they put a scope through their own sterilizer hundreds and thousands of times, but they're not using the tray wrap, the tray liners, the tapes, the traceability labels that we use. So when I invite these people in, they're getting not only to see the equipment in use, but exactly how our workflows work. Because I will give you an example. Not so long ago, we took in a scope from a supplier, and they, in their IFU, they outlined the particular low temperature sterilizer, the particular cycle that it needs to go into. We took delivery of the scope, started the decontamination process, wrapped the set, got it ready to go into a sterilizer, and then when we pushed the item into the sterilizer, it wouldn't fit into the chamber.
Right. Okay.
So it's really about engagement. Yes, the scope itself was compatible with that cycle, but when you add on the transportation box, you add on 2 or 3 layers of wrap, all of a sudden it didn't allow the chamber to close. So it's really about engagement and getting those people in to see exactly what happens in a CSD department.
Yeah. And I guess in this scenario, it's right, is in to say like the IFU meets what we're looking for here. It probably has done, like you said, the responsible testing in terms of what it's being exposed to, the chemicals, the heat, all those sort of things. But actually, operational or practical testing may not have been necessarily included at that point. So are you seeing a shift in that at the moment, or is it still kind of there's good things that can happen that they all go to plan, or sometimes it's just that final test it's just missed that beat, and then the suppliers are quite happy to take on what you've said. They go away and retest and get it so it's compatible as to how they said it would be.
Yeah, it's definitely gotten better. I suppose here in Ireland we have frameworks for a lot of things.
Yeah.
So orthopedics, spinal, all that kind of stuff, we would have maybe one or two suppliers. So they are very good at engagement because they need to, because they're number one supplying all of the 56 hospitals in Ireland. But it's the other smaller independent companies that maybe don't have the financial backing of some of the larger companies. They're the ones who sometimes can not see the benefit of engagement, or maybe even changing their processes to fit ours.
Yeah.
It's definitely improving, but there's a long way to go yet.
Yeah. And from that, Trevor, like how do you create like this whole culture here where this is a problem, yes, but how do you then create a culture that they become opportunities rather than things that we need to not be involved in or hide away from, or almost put a stop to things? So how do you kind of create that culture of engagement from everybody?
Um, it's definitely about communication. So it's getting the right information to the right committees, the right stakeholders. It's engagement with these suppliers who are implementing and manufacturing these devices. And then it's about what value those devices can make to your processes. And then, like I said, it's always just keeping the patient outcomes to the forefront. And I suppose anything that can help improve that, I suppose something that will always be looked at here in the matter.
Yeah. And like the bit that I'm looking into now really is more, taking the center of excellence piece and putting a bit more on it, which is if you're regularly looking at changing or bringing in new technology, new innovations, obviously what needs to follow with that is education. So where we've been like, ourselves included, where we're in positions from trying to essentially bring knowledge transfer to the forefront of certain things and keep it updated, keep it sort of moving in the space that it needs to. There's been a huge shift in the profession in developing people within the decon spaces. So, it's not very typical, but we're looking at changes to decon. We're seeing very focused decontamination training and certification coming to the forefront as well. Why is this like all of a sudden becoming such a huge thing? And, have you seen a gradual change, or has it been quite sudden in the level of education that's being delivered?
I think I think our Department of Health, so the NHS in the UK, HSE here, are eventually listening to kind of key influential people. Like I think it's about sharing and getting the awareness out there that the important work that CSD departments actually do. And it's about getting the recognition for this role, because if you didn't have a functioning CSD department, your theatre departments would stop. So I think it's about having these third level education programs out there. There's a very good one here in Ireland in TU Dublin. I think TU Dublin has educated nearly 2,500 decontamination staff here in Ireland for medical devices and endoscopes. But also it's I suppose it's not to forget the importance of your education groups within this sector. So I suppose the IDI in Ireland and the IDSC in the UK. So, but also it's about sharing as well. I suppose when I started in this sector first, it was very much keeping things within the department, and very backward way of thinking, in my opinion. But I suppose as education has developed, these education groups, people are talking a lot more. They're sharing experiences, they're sharing outcomes, and what that has done is it's given this role and this career real purpose, if that's the right way of saying it.
Yeah. And I guess there was a shift in a lot of things where people were coming in different levels. There was definitely just like technician roles, and then it sort of evolves into there's a career path essentially. So there is also those things to consider. And I think just on a more international level, like when you have other overseas, people come over just to see the Centre of Excellence, see the work that you're doing, see the work how suppliers are sort of supporting you in that role as well. What are you learning from their own practices? Like, do they value similar sort of values that we have with the HSE with the matter?
No, some do. Like I suppose something that is taking me aback by listening and dealing with other guests to the COE. Like you'd be amazed at these wealthier countries that would have a lot of money and they would spend a lot of money on decontamination equipment, change them quite frequently. They would put a lot of money towards building new departments,
Mm-hmm.
and then they come here and they're amazed at what we're able to achieve in a building that's 100 years old. And it's just simply because like they have the money to spend, but they don't have standards or operating procedures.
Yeah,
Another thing that I was completely taken aback by, they're more than happy to spend all this money, but electronic traceability has never factored in, and they're happy to write with pen and paper. So I suppose they want to come, they want to learn, they want to see the best practices that we have,
yeah,
but definitely by far the standards that Ireland and the UK have, and it should be something that's commended, because lots of other countries don't have half of what we have.
yeah. And I guess, like you just said, they're coming over for educational purposes, so they're wanting to learn, the best practice, because that's the kind of the staple, isn't it? It's like we want to achieve best practice in any way we possibly can. And I guess it's not necessarily just from that line alone. I know that the approaches can be different. Like you said, the track and trace is still manual. It hasn't quite hit that digital age just yet. Yet it's probably, something that they've got the access to do so. So that will definitely create sort of this space of, look, as things become far more complex, other technologies do creep in at that point as well. So I think just to kind of look at this as I have been throughout this, is just obviously the key bit for me is understanding how you measure success in decontamination. What do you take as the small wins? What do you take as the big wins? And, what are those key indicators? So to speak, if people can celebrate the successes that they've got, that they're aware that a small success is just as good as some of the bigger successes as well. So how do you measure the success yourself in your department?
I suppose how we measure, I suppose obviously like it's non-conformances and infection rates. I suppose that's something that we look at here on a regular basis. But obviously, like my role has changed hugely over the last couple of years. It's very much a data role. It's
Mhm.
it's obviously sustainability. It's productivity is a huge thing that I'm asked about on a regular basis, and then it's getting that information to the right people. So obviously for me, the productivity is it's a real shock element to it,
Mhm.
because your clinicians, your CEOs, your financial controllers, uh, they actually have no idea how busy your department is. And when they find out the numbers that you're raw processing on a daily, weekly, yearly basis, can completely take them back. So it's getting the information to the right people. And then yeah, celebrating the successes. So it's like here in the matter, celebrating the success that the biker made won the award, and celebrating the success of the COE, where it's gone oversubscribed year after year. So it's celebrating those little pieces, but also as well, it doesn't need to be big extravagant things like COEs. It's
Mhm.
uh, updating an SOP, making patient flows better. It's just celebrating the little successes, and making sure your CEO, the board, and all of the other key stakeholders are aware of that.
Yeah, that's the key bit. Because I think you'll notice in some of the previous podcasts that we've done as well, is that we've mentioned that celebrating, the unsung heroes. Essentially, it's the whole purpose of this. But I guess the question I have for you really, which doesn't take us into an interview as such, because it's one I definitely would be asked if I was sat on the other end of the table looking at jobs and stuff, is that 5 year kind of vision. You know, what have you got short term that you really want to achieve within decontamination services, and more so, where do you see a bit more innovation happening in the next 5 to 10 years? It's a horrible question, I know, because not much has changed, but we do sort of see things creep in.
Yeah, look, I suppose I think sustainability and AI is going to play a huge part in how we run our departments over the next decade. And it's about how we introduce that new technology and new innovation into our already very crammed and busy CSD departments. I suppose short term, I do believe endoscopy is where we're going to see the largest change quite soon in terms of possibly the sterilization of endoscopes. But I'm sure that's a whole different topic that you can have.
Yeah. But then I guess, so the kind of bit where we're at is you've got access to some of the latest innovations, you've got access to some of the latest technologies, and you're going to be in a quite a nice position to, because you've achieved some things, you're probably looking further ahead than others. So the final question I have, and to kind of get us to the end of this, is that if we're going to have other decontamination listeners to this video, what's your message to them about sort of raising a bit of a profile within not just the organisation that they're in, so a trust or a hospital, but the impact of their work and the impact of this? Because you mentioned earlier celebrating the successes, but how do we raise that profile in decontamination and the impact it has on hospitals?
Yeah, look, I suppose I kind of touched on this already, outlining the small successes to your CEOs, your clinical leads, the boards, basically anyone that will listen to you. Because obviously, like I said, for long periods of time, decontamination wasn't even discussed. And if you went to some of your clinicians in your hospital and you asked them where the CSD department was, they didn't know, and they didn't even know what CSD meant. So it's about embracing those, inviting those people down to your departments. So yearly we would invite clinicians from theatre, outpatients, A&E, down to the department as a kind of an introduction to CSSD. And then also as well with your little successes, get onto your professional education body like the IDI or the IDSC, and it's presenting those and letting your peers, your colleagues hear the successes that you've had, because the success that you've had is something that we could implement in our hospital and learn and take something from that. So it's definitely about promotion, getting it out there, and yeah, not to be afraid.
Yeah, perfect. And I think you rounded it off really nicely there as well, Trevor, because there is a community involved in this. There is a collaboration piece involved in this. And I think, I speak as a supplier to some of this technology as well, is that really we're noticing that there's a real push for change, not just amongst, the demand, but more so we want to work together with suppliers. We want to work together as trusts, organizations to help build these innovations. Brilliant. Trevor, I literally can't thank you enough for doing this for us today. As a final piece, really, listen, I really wish you all the best with what you're doing next, and we're excited to hear what we're doing for the next 5. If I can get AI to you in 10 years, brilliant. But I'm also hoping that there's going to be some things that do really excite us in the latest technology that comes out there. So thank you very much for that.
Yeah, so do I. I have a couple of new toys coming as well. So
Nice.
so hopefully you might hear about them in the next 12 months or so.
Brilliant. Trevor, listen, thanks for joining this episode. So that's Behind the Mask. We really hope that this reaches the people that it needs to, because it's going to really insight people into what innovation is within healthcare.